afternoon. To give everyone an update, our cumulative total number of cases in Tulsa County up till today is 983 people have been diagnosed positive with COVID-19. We had 23 new reports today. Good news is that 774 people have recovered. Unfortunately, 51 residents in Tulsa County have passed away from COVID-19. That includes 2 today. Both these individuals that were reported today were over age 65, and please keep their families and those individuals in your prayers. As you know, and we've been talking about this since all this started, it's really important and it's critical to follow the data. So right now, our case trend is almost flat. We have a very marginal decrease in our trends, although our rolling 4- and 7-day averages are still increasing. Daily number of patients in hospitals have been steadily increasing since May 11th, with a marked increase since May 15th. But bottom line is that at this time, those levels remain manageable by our hospital systems. And if you want to look at all the data, please get on the Tulsa Health Department COVID page website. We're very transparent, and all the information that you need should be on that dashboard. Once again, we continue to test. We continue to expand testing. Anyone who wants to test can get tested at the health department. Make an appointment. Call us at 918-582-9355. This month, Oklahoma set a goal to test 90,000 people in May. Tulsa Health Department worked collaboratively with Oklahoma City County Health Department and the Oklahoma State Department of Health in a unified command on COVID-19 response. And together, our agencies, working with our local hospital and healthcare systems and long-term care facilities, have exceeded that 90,000 goal, and we've tested over 118,000 people just in May for the state. We will be offering free COVID-19 testing in North Tulsa next Friday on June 5th during the Unity and Community event taking place at the 36th Street North Event Center. We'll be set up next door with tents in the parking lot of the Greater Union Baptist Church offering COVID-19 testing from 4 to 7 p.m. No appointments necessary. You can walk up or drive through. A public health professional will use a nasal swab to collect a specimen for testing, and the whole process should take 5 minutes or less. You will receive your results on Tuesday. Our nurses will be on site with the Oklahoma Caring Van offering childhood immunizations at no cost to those who qualify as well. It's important for parents and children to keep up to date on immunizations so we don't see an increase in vaccine preventable diseases as well. As you know, phase 3 is starting on Monday, June 1st. If your business has questions on how to operate safely, visit our website for guidance in both English and Spanish. The Tulsa Health Department worked collaboratively with Oklahoma State Department of Health and the Oklahoma City County Health Department and the Oklahoma Restaurant Association to develop guidance for phase 3. I think for food establishments, they should continue to encourage social distancing between customer groups and maintain increased cleaning on frequently touched surfaces. Outdoor dining areas may resume regular capacity while still allowing for 6-foot distancing between groups. Banquet space and meeting venues may operate while continuing to follow local requirements for group sizes. Events and meetings should maintain 6-foot distancing between groups. Outdoor and enclosed large venues such as ballparks and arenas should maintain spaced seating between groups that do not share a household, such as every other row. Empty, staggered seating, or at least 2 seats empty between parties. These venues should also develop plans to provide physical distancing throughout the facility. Again, Tulsa Health Department, and we will continue to do this work, but we will continue our epidemiological investigations, primarily contact tracing on all confirmed positive cases of COVID-19 in Tulsa County. A representative from Tulsa Health Department will call individuals in facilities that have been exposed to a confirmed case to assess the risk and make a recommendation, including isolation and quarantine if that's needed. If you receive a call from someone saying they're from the health department, that individual will never ask for money. They'll never ask for your social security number. We've also heard, we've gotten reports from people who said that there's been knocks on their door from people saying they're from the Tulsa Health Department. We won't come knock on your door as well. We'll contact you through the phone. At the Tulsa Health Department, we will continue to provide Clinical Services at Central Regional and James O. Goodwin Health Center will be announcing plans to reopen community centers in Sand Springs and in Collinsville later in June. WIC services are available by phone or online through June. WIC is for women who are pregnant or just had a baby, infants and children under the age of 5. Enhanced cleaning and screening to ensure safety of all our clients. We're very much focused on that. We're focused on ensuring that all potential test points are cleaned and disinfected regularly so that all of our staff and all of our visitors remain safe. And just to answer that question before it's asked, yes, if you come to one of our facilities, you will have to wear a mask. So we're able to reopen more now thanks to everyone doing their part. I think in Tulsa County to slow the spread. You have a direct impact when you wash your hands, wear your mask, and your social distances. And we know that this has not been easy. We appreciate everyone's role in saving lives in the community. And bottom line, I think in going out in the community and talking to people, I know that many people in Tulsa County are really over COVID-19, but unfortunately, the pandemic is not over. So remember that, remain vigilant, wear your mask, wash your hands, social distance, and continue to do this until we actually see signs of this virus going away. Thank you for your time, and I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. As the governor announced in the last hour or so, we will commence phase 3 in the state of Oklahoma beginning June 1st. And I will sign an updated executive order later today that mirrors the state's guidelines in that regard. I think it's very important to understand that the state has identified that the state of Oklahoma meets the necessary benchmarks to move ahead with phase 3. Fortunately, as was the case with phase 2, in Tulsa we also meet those benchmarks. So this isn't a case of us being out of lockstep with the state. Again, the key for going into phase 3, as the state's defined it, is hospital capacity. I checked in just this morning with the leaders of each of our major hospital systems in the community. Each of them reassured me that their capacity in their hospitals remains ample, and that they've seen overall COVID hospitalizations remain relatively flat in their systems here locally. So that's very good news. And again, I can never thank the citizens of Tulsa enough for doing the hard work in the early going of this pandemic in our community that allowed our hospital systems to create the capacity and obtain the equipment that they need to handle this event the right way. And that's what's allowing us to go through and conclude phase 2 now and to move on to phase 3. Now, what does phase 3 look like in Tulsa? How does that change? Well, first, the state continues to provide what I think are really useful guidelines that any industry, and they've broken them down by industry and by event type, and you can identify those at okcommerce.gov. You can go on to the state's website at okcommerce.gov, and they have their overall guidelines for different facets of your life and also for different industries and different events that may be held. For us at the City of Tulsa, most of our employees have remained out in the field throughout this event. In my mind, that's one of the things that's so extraordinary about the public servants that we have that are working at the City of Tulsa. They've continued to be out in the field, fighting crime, responding to medical emergencies, keeping our streets fixed, fixing our water lines. And so many of them have continued to do the work that can't be done from home. You can't do any of that stuff in remote work. You have to be out in the field and doing that, and they've continued to do that. But we have about 1,000 employees at the City of Tulsa that have worked remotely throughout this event, and they will return to work on Monday, on June 1st. And we've put in systems in place at our various city facilities to make it safe for them to do so. It's important that as we move into phase 3 and the the state's additional guidelines that they're putting in place, that everyone, as Dr. Dart said, needs to remain vigilant. We're continuing to do really a nationwide, city-by-city experiment in how we can get as close to life as we knew it pre-pandemic while doing so safely. And each community, you think about the term that the Founding Fathers used about creating laboratories of democracy. You absolutely see that in effect right now in states and cities all around our country, as different states and cities are at different stages of this reopening process. For us in Tulsa, it's so important that we continue to be smart about how we go about our lives while we try to re-engage so many of those aspects of our lives that we weren't able to participate in over the last couple of months. And the data continues to show that Tulsans are being smart. I mean, the fact that our overall trajectory rate, while it did increase over the last several weeks, as was to be expected, it wasn't a sharp increase, and our hospitalization rate remains relatively flat. That is due to Tulsans and people in the Tulsa metro area being smart about how they go about their lives and taking those precautions that protect themselves and their neighbors. For our parks, that's probably one of the areas at the city government that is most outward facing, that we've had to have the most restrictions around. On Monday, all of our city playgrounds, splash pads, our outdoor exercise equipment, our basketball courts, they'll all be reopened with social distancing and other restrictions in place so that people will be able to utilize those park functions but do so in a safe way. The community centers and specialty centers like Oxley Nature Center and Waterworks will also reopen with updated hours on Monday, on June 1st. Our park water fountains will be closed, so if it's hot outside and you're planning to go have a great time at one of your Tulsa parks, please bring water with you. Our pools will remain closed, but at this point, that is not a public health decision, that is a budgetary one as we navigate the fiscal impact of this event, as well as international issues relative to the energy industry that are impacting our local economy. Starting in June, utility bill collections will resume through a phased approach. If you've been impacted by COVID-19 and that's presented a challenge for you in paying your water and sewer bill, if you haven't already, please contact the city at 311 to set up a payment plan so that you can continue to have water and everything that you need at your home moving forward. But we need folks to set up and work with our utility service to set up those payment plans. Lastly, I really want, this isn't COVID related, but I really, just on behalf of all the citizens of Tulsa, I want to thank all the first responders in this region over the last week who gave everything they had to find those kids. It's been, I thought both Chief Franklin and District Attorney Kunzweiler said it so well earlier. I think for all of us who are impacted by that, we responded to it, I know I did, as a dad, in thinking about my kids, my little boy and little girl, and not being able to imagine the hardship that our first responders went through this week, giving everything that they had to find those kids, around the clock. Didn't matter what jurisdiction they were from, didn't matter which city or county or law enforcement agency they were with, they all stepped up to try and help save those kids' lives. And it's a reminder that Tulsa is a community where our first responders still take it very personally when it comes to protecting our neighbors' lives, and especially the lives of kids. And so we pray for Miracle and Tony and their family members who loved them. I think it's so important that having seen as mayor the toll that search took on our first responders who were giving everything that they had to find those kids for days, I hope they know how much the people in this community appreciate their work and how hard they worked to save those kids. And so now I'd like to turn it over to County Commissioner Karen Keith.
Thank you, Mayor. We had a little computer crash right before I came over here, so bear with me a little bit because I'm going to cheat. But I just so appreciate the heartfelt words of the mayor. This past Monday, I wanted to let you know that the BOCC approved some CARES Act funding. It was about $550,000 in a partnership with the Chamber and TEMA. And those funds will be used to help small businesses stand up their work with the PPE that they need to reopen their doors. So that's a first tranche of money to come out. And as of yesterday, the review committee, they've received approximately 50 applications. And next Monday, we expect to approve about $1 million in requests from municipalities at the County Commission meeting. Work continues to create a process that will work for both small businesses and for our nonprofits who are seeking relief from COVID issues. On Monday, the BOCC also plans to review a resolution that will allow county employees to work as poll workers. As all of you know, most of our poll workers are elderly, so we need some 800 poll workers to man the polls for the June election. We've got 3 elections coming up, including the November election, which is huge. And so we feel like it's incumbent on the county to allow our employees to be able to do this. And then we're also going to reach out to some of our larger employers and see if they too would be willing to allow some of their employees to step up and serve. So there is some brief training that's required. You can call our election board secretary, Gwen Freeman, if you want additional details, and you'll be getting some things in the email from me if my computer gets back up and running. Now I'd like to shift gears and give you a little update on the old Juvenile Justice Center on Charles Page Boulevard. And it's being used by the Day Center for the Homeless and the Salvation Army to assist with social distancing needs in that population. Now, of the 50 men being housed there, they've been testing the majority of them, and they had 1 case, and that gentleman was taken to the quarantine hotel. So there have been no additional positive cases, so things are still going well there. Now, the Day Center for the Homeless, they continue to house 60 to 65 individuals, even while they're undergoing these major renovations. And Monday, MAC announced that they'll be allowing 10 individuals to come in during the day for limited access to all the services they have, including the clinic. So that's good news. And at the Tulsa County Shelter, so far, so good. They are now screening for all the families that are being allowed to move in. So we are taking additional families. And I'm also happy to report that Morton Health is offering testing for all of the homeless population as well as our staff who are dealing with that group. And they're doing those on site when possible. Another important update, the Family Safety Center is going to reopen on Monday. And of course, that's for victims of intimate partner and domestic violence, sexual assault, stalking, and elder abuse. So they'll be there to help you file those emergency protective orders. But you need to come by yourself and arrange for child care. You will be the only one allowed in. And they'll have all sorts of protocols set up like everywhere else for you need to wear masks. They don't want you to come in sick, but they will be open 8 to 5. And lastly, we expect phase 2 of the Tulsa County District Courts to begin on Monday. Presiding Judge LaFortune let us know that the Supreme Court mandate is still in effect, requiring masks in all areas controlled by the courts, and the number of people who can gather will be raised from 10 to no more than 50, but strict CDC guidelines must be followed. The district courts have continued, and I'm so grateful for this, to stagger their dockets, and they're using low traffic hours to stand up courts during those time periods that weren't previously used. So Judge LaFortune's goal is to reduce the population in the courthouse. And the traffic division of the courts will be handled by telephone conferences with the DA's office. That contact information will be provided by the judge's order today, or you can simply call the DA's office if you want more information. So if you have a traffic ticket, do not come to the courthouse. It is not necessary. Simply call the DA's office. Now, anyone with small claims or forcible entry or eviction cases, you need to go to the new Family Center for Juvenile Justice. Do not come to the courthouse. And again, access to the courthouse will still require a mask at every entrance. We continue to ask that you do your business electronically. All the offices have made it very easy for you to do a lot of your work by phone, so we ask that you honor that. And again, if you come to the courthouse, please follow all of the protocols and social distancing that is being asked of you, the elevator loads, the hand hygiene, all of those things. And that helps us keep our employees safe as well as you. And a final plea, don't come to the courthouse if you are sick. Every office has made great strides to try to help you do all of your business needs without appearing there in person. And on a personal note, I have a 91-year-old mother, and I have a sister who is going through chemo and radiation. And I need you to wear your masks in public. It's a really simple request. It keeps everybody around you safe. It's not about you. It's about everybody around you. So, wear your mask. Thanks.
Any questions now? Does that have anything about the dark?
Thank you.
Okay, Dr. Dark?
Dr. Gard, did I hear you right that there are people going door to door disguised as PhD officials trying to get my information? Is that right?
We got one call, one report from one individual, so hopefully it's not a widespread issue. The question was, are there people impersonating Tulsa Health Department staff come to your home? And we're hoping it's just an isolated case and nothing for us to worry about, but we want to make sure people were aware that if you hear from us, you'll hear from us over the phone.
Are the testing centers that have been set up for any places, are those just going to continue indefinitely because COVID is still out there?
So we had a question about our testing. We're currently in the process of creating a long-term testing strategy, so we can really figure out what the penetration is of COVID in our community. So we will hopefully finalize that plan in the next 2 weeks, which might look probably different than it does today, but testing will still be here in Tulsa County for probably quite some time.
Heard beautiful silence there for a minute. I thought no one had any questions for me.
Any concerns going to phase 3 with the businesses, everybody, anything?
No, I don't have concerns around that right now because we've been trending in the right way really throughout most of phase 1. I had concerns going into phase 1 because Tulsa County wasn't seeing the same trajectory as the rest of the state was. But fortunately, we really moved into a similar trajectory during the course of phase 1. And in phase 2, we were on hitting the same benchmarks. And now throughout phase 3, the most important thing for me is monitoring that healthcare system capacity. When we started the whole flatten the curve movement, the point of that was not that we wanted to make sure no one ever got COVID-19. That's an unrealistic expectation to have. The point of that was to reduce the load, a surge of people hitting our healthcare system and needing assistance and overloading it, and people dying because they couldn't get the healthcare that they needed. Fortunately, Tulsans responded. People throughout the metro area responded, similarly in the OKC metro area. And because of that, we avoided that spike on our healthcare system. And they went from some of those hospitals having days worth of PPE available to now having over a month of availability. And now we're in a position where we're maintaining ample capacity within our hospitals for people who need treatment. And that's in our 3 major healthcare systems. That doesn't even include the 120 beds that the U.S. Army Corps of Engineers installed in OSU Medical Center that are solely for COVID patients. And so I feel good right now about the ability of our local healthcare system to handle this. But it's still, there's only so much responsibility that business owners and public spaces can take on. The real key to us being successful in this and slowing any upward trajectory is with individuals throughout the community. And thankfully, to date, individuals have been cautious and smart, and you see that borne out in the data on the spread of the virus and on hospitalizations. So I think, if I thought Tulsans were being reckless or unwise during phase 2, then I'd have concerns about going into phase 3. But I think Tulsans are doing it the right way.
What happens to places like the BOK Center and the PAC and the Convention Center, especially? Are you putting special orders in because the city has a hand in those operations, or how do you move forward with those things?
So that's a great question. The question is, how do we handle larger event venues, and what will that look like? I think there are 2 different ways to look at that. One is just purely from a regulatory standpoint, and the state, in their guidelines that they're issuing, that they include how to approach different special events and larger events and precautions that should be put in place. That reminds me, one thing I forgot to mention earlier is that we will start special event approvals again as of June 1st moving forward. But in each of those, we're going to want to know what precautions those special event holders are going to put in place to be safe and smart for people. Now, the other dynamic, which we have no control over from a regulatory standpoint, but is equally important, are just sheer market dynamics. When it comes to like the BOK Center, everything I'm hearing from concert promoters is that they don't expect any significant concert tours to really go into effect probably through the balance of this calendar year. And so that's going to address itself from just a market demand standpoint. But on each larger event or special event, I think those have to be approached on a case-by-case basis with a focus on social distancing and hygiene and how that can be provided.
We keep hearing about maybe round 2 in the fall. When does the moment come for you to pull the trigger again and us to go back in our houses? Or is that even part of the plan moving forward?
Well, I was having a conversation with some of the leadership team at the city this morning, and we're talking about how fortunate we felt Tulsa was to have handled this the way that we have over the last several months. When you look at, our death rate per 100,000 and compare it to a lot of other cities around the country and around the world that have, multiples larger than we've had here. And we've done that at a time when we've, no one's been an expert on how to deal with coronavirus or COVID-19 because it didn't exist 6 months ago. And so how do we handle that? And how do we deal with the first real global pandemic that our city has had to deal with since the Spanish flu over 100 years ago? And the real answer to that is that we are so fortunate to have independent, professional experts at the Tulsa Health Department that give us that local expertise and guidance and help us know what the smart thing to do is for Tulsa, not for the whole state or the whole country or the world, but based on the realities on the ground here in Tulsa, what should we be doing? And I've relied on that guidance throughout this event. I'm not going to cease relying on that guidance as this event continues. Because this event, phase 3 doesn't mean that coronavirus is over. Dr. Dart made a great point earlier. It continues. It's just the way we're going to go about our lives in the midst of this pandemic. We're going through phases of change during that. So moving forward, I will continue to rely on the guidance of the Tulsa Health Department and the experts that we have there. And then, as I mentioned a moment ago, the number one thing that I'm focused on is the capacity of our healthcare system to handle this. And so, if we do have another a wave, as some are saying we might at some point before a vaccine's readily available, then that's going to be who I continue to consult with and talk with about whether or not they feel like they can handle that wave or not. Fortunately, though, our healthcare system now knows what they're dealing with and can prepare accordingly. Whereas, at the outset of this, we were all being hit by a brand new virus that, we were very fortunate here in Tulsa and in Oklahoma to have about a 2 to 3 week lag time between when it hit the coastal United States and when it got here. And that allowed us to prepare and take action that I think saved a lot of lives in our community. But moving forward, our healthcare system will be able to prepare and have more time to prepare than they did in this particular instance.
Anything else? Or
Mayor, any concerns about protests this weekend?
Oh no, I mean, we have a free country, and one of the key things that is part of that is freedom of speech. And if people need an outlet to make their voice heard, then a peaceful protest is about as American as it gets. Now, what I think that we have not had historically here in Tulsa, and it always bothers me when you see like the events that happen in Minneapolis overnight, or there's concern about it happening in other cities around the country. People start saying, well, what if that happens in Tulsa? My response to that is always, historically in Tulsa, the black Tulsans have not been the instigators of riots here. They've been the victims of them. And so let's keep that in mind as we're fretting about what may happen when we see things that are happening in other cities around the country. What I do hope for this weekend, though, is that all Tulsans can take a moment and really reflect on what can happen, even here in Tulsa, when anger is allowed to escalate to lawlessness and violence, and the lives that can be lost as a result of that, and the lives that were lost here. And we have so much work to do as a community, even 99 years later. But I do believe that most Tulsans want to do the right thing in 2020 and moving on forward towards the centennial commemoration next year as well.
Any other COVID-related questions? All right, thanks, everyone.
Thank you.